Okay. Now the flow of my presentation is like this. Firstly, we will start with you people. It is an activity. What does disaster management mean to you? One moment, please. I hope the noise is reduced now. So the flow of presentation is like that. A brief sum up of topics covered so far. One of you, I will be requesting to, not one, two of you to let us simply summarize in about 5 sentences as to what all topics have been covered in this workshop about disaster management. And what are the hurdles in carrying out effective disaster management services? This also, I will be requesting you people to come out with what are the hurdles or bottlenecks that you have come across or may have observed or come to think over in the course of these 4-5 days. Then I will be talking about social work. What does social work mean and what is the discipline all about? And what are the methods through which social work works? And then where is the scope for intervention for social work discipline in disaster management? And what is the scope for intervention in a disaster situation for teachers like you and me? So with this brief introduction about the flow of presentation, let me start with the presentation. So the first one, like I mentioned, is an activity. So I want two people in this session to unmute themselves and share with us what are the topics that has been covered so far in the session. I would like to have volunteers rather than me calling out names from the list of participants. Who would go first, please? Quickly. Hello. Can you be a little louder, madam? Pushpashri, madam. Who started talking? Somebody unmuted themselves. Okay, anyone else? I want one of you to please start with summarizing as to what had happened in the past few sessions.
Ma'am, hello, ma'am.
Hello, Sahana,
yes,
madam.
I'm talking.
You are Sahana, right?
In the first day, we had an introduction about. Yes, ma'am. Yes, ma'am.
Yeah.
So first day we had an session on introduction to disaster management. Then we had a session in the afternoon about natural disasters. What are those and what are the different kinds of disasters and stuff. Then on the second day we had Dr. VLS Kumar concentrating on first aid and emergency response using disaster. During disaster management. Then we had another session on GIS sensing technology uses during disaster management. Then we had women and disaster management, that is vulnerable groups being as a part of disaster management and how well it can be managed and stuff. And we also had a session on man-made disasters management.
Okay, thank you, Sahana madam. I want somebody else to take on from there. She has covered till vulnerable groups and man-made disasters. So afterwards, what topics were covered?
Good morning,
somebody madam. Else, please volunteer.
Good morning, madam.
Good morning, sir.
Madam, ನಾನು 24 Afternoon, Professor A.G. Devi Prasad sir from Environmental Science University of Mysore delivered disaster and health. And evening session, disaster management and mental health delivered by Professor Lancy D'Souza from Maharaja's College. And 25th, Madam, Professor Ashok Rao delivered man-made disaster management. Afternoon session, disaster risk assessment and management delivered by Dr. Ashok Sanganal. Then 27th yesterday, earthquake disaster management delivered by Professor S.K. Prasad, Madam. Afternoon session, my close friend Professor P.L. Hemchandra from Maharani's Post Graduation Center. It covered meteorological and hydrological and geological disaster management.
Okay. Thank you, sir.
Thank you, Madam.
Okay, so I thank Sahana Madam and Doddarasaya sir for volunteering to let me know what were the topics covered so far. It has worked as a refresher for all of you also. So now, other than these two people, I want two more people to attempt this. Have you, any of you, encountered in your personal capacity anything in your state or in your district, something near to disaster, or have you really faced any disaster yourselves? So these are the next two questions I have for for all of you. Have you encountered any disasters? Or is your state vulnerable to any particular types of disasters? Let us personalize it a little, because otherwise it is just theory. But our course and our work is not just theory. When a disaster strikes, all of us will have to get involved. I am sure all of you have encountered one disaster, which I have also encountered quite a lot of, with a lot of trepidation.
COVID-19.
Yes, exactly. Now I am laughing about it, but all of us have suffered so much during COVID, isn't it? Personally, professionally, and sometimes many of us have lost near and dear ones. We have been lucky to survive the disaster. Yes, other than COVID. COVID is a biological disaster, infectious disease, and it was a disaster for the world, right? Correct. Any other? We talked about natural and man-made disasters. So any other experiences of floods, tsunami, especially people from Tamil Nadu, people from West Bengal and Maharashtra also. In the coastal areas, if you have been residing, I'm sure hurricanes, tornadoes are a common experience for people in those regions. And drought also, and extreme flooding, all these, I'm sure some of you might have encountered. Anybody would like to share their experience? Please feel free. Quick but. Shashikala madam, would you like to say something?
Yes, madam.
A little louder, please.
In rainy season, urban flood,
Madam, I don't know. I'm not able to hear you very clearly. Can you speak louder or increase the volume of your instrument? Okay. Till madam speaks, somebody else would like to say something on these two aspects of the questions. Quickly. This class is not at all active. I'm sorry to say it. Are you all busy doing some office work instead of attending the session?
Good morning, ma'am.
Good morning, sir.
So, Abhishek MP from Bharati College.
Yes, sir.
So we are myself also experienced experience on flood, ma'am. So because of our village come backward side of the Kaveri River or Nemavati River, some of the rainy seasons we are also facing flood.
Okay.
So impacted us our life, ma'am.
Okay. Okay. Thank you, sir. Anybody else? One more participant. Any personal experience of facing disaster? Okay, can somebody share their experience of personally having come across COVID and facing the treatment situation? I'm sure many of you have had that experience. Anyone? Nobody?
Can I continue, ma'am?
Yes, please.
Ma'am, in the duration of COVID, I am working as a district SBCC coordinator in Tumkur district. That time we are facing so many kind of issues regarding to communicate with the people, especially in the border villages or border blocks in the Tumkur district. That areas are facing more than people are living with connections with the Andhra. People are communicating Telugu only. District administration and we are also planned with Kannada medium only. Time also we are facing so many communication issues and challenges, and that time also we are facing in local level.
Thank you, sir. Thank you. Here, I would just like to share my personal experience with COVID. One of my relatives had COVID during the second wave and admitted to ICU. They asked for, I'm sharing my personal experience, the third point in the PPT. They asked for plasma. We did not know where to get the plasma. And the blood we could get, but getting plasma was very difficult. The process of recovering plasma from body requires about 3 to 4 hours, and then cleaning it up and giving. And the condition was that the person who gives or donates plasma, it is like blood only, it's a part of the blood plasma. And that person should have recovered from COVID about at least 1 month after COVID, but before 3 months has elapsed from recovery. That time only their body will have COVID resistant plasma. So it was a very tough challenge, and finally we identified 2 donors. They came and they provided plasma also. In spite of that, after giving plasma also, we lost our family member. And but unfortunately, even the cremation we could not do properly, in the sense like all of us couldn't go because there was restriction on the number of people who could go and join for the cremation, and only immediate family members could say adieu to the person who departed. So this is my experience of facing a disaster. And this biological disaster left a very strong impact on me as to what a victim goes through when faced with such a situation. So after going through all that, then I come to the next activity, that is Abhishek sir already enlisted hurdles in providing services to the victims and survivors of disaster. In COVID situation, he said language and communication was a barrier. Any other barriers that you can think of about while managing disasters. Again, I want 2 responses at least from others who are not who have not answered so far. Quickly. Anyone? Shall I call out the names then? If you are all not coming forward. Okay, how about Mr. Prakash BK? Mr. Prakash BK? Can you unmute yourself? Are you there? Mr. Rajanna? Mr. Rajanna?
Yes, madam, ready.
Uttara Kudi, sir. Participants to enlist the hurdles in providing services to the victims and survivors. Can you identify one hurdle or bottleneck?
ಮೇಡಮ್ ನಮ್ಮ ಊರಲ್ಲಿ ಒಂದು ಈ ಘಟನೆ ಆಗಿತ್ತು ಮೇಡಮ್ ಇತ್ತರದ್ದು ಕೋವಿಡ್. ಆದ್ರೆ ಅವರು ಆಸ್ಪತ್ರೆಗೆ ಹೋಗ್ಬೇಕಾದ್ರೆ ತುಂಬಾ ಕಷ್ಟ ಆಯ್ತು, ಯಾರು ಬರ್ದೇ ಹೋದ್ರು ಸಹಕಾರ ಮಾಡಕ್ಕೆ. ಆಮೇಲೆ ಬಂದು ಮೇಡಮ್ ಅದು ಏನಾಗಿತ್ತು ಅಂದ್ರೆ ಬರೋ ತನಕ ಶ್ವಾಸಕೋಶ ಸಮಸ್ಯೆ ಹೋಗಿ ಊರ್ದ್ರೆ ಇದ್ ಮಾಡಿದ್ರು. ಆಮೇಲೆ ಇವರು ಮನೆಯವ್ರು ಯಾರು ಹತ್ರ ಹೋಗ್ಲಿಲ್ಲ. ಮನೆಗೆ ಏನಾಗುತ್ತೆ, ಅವರು ಹಾರ್ಟ್ ಸಮಸ್ಯೆ ಇರೋದ್ರಿಂದ ಸತ್ತೇ ಹೋಗ್ಬಿಟ್ರು ಮೇಡಮ್. ಆಮೇಲೆ ತಂದಾಗ ಊರಲ್ಲಿ ಒಬ್ರು ಬರ್ಲಿಲ್ಲ ಮೇಡಮ್. ಒಬ್ರು ಈ ಅದು ಹಳ್ಳ ತೆಗಿಯಕ್ಕೆ ಬರ್ದೇ ಹೋದ್ರು ಕೊನೆಗೆ. ನಾವೇ ಎಲ್ಲ ಸೇರಿ ಅದನ್ನ ಮಾಡೋದು. ಬಟ್ ಅದಾದ್ಮೇಲೆ ಕೆಲವರಿಗೆ ಇದು ಹತ್ರ ಬಂದ್ರೆ ಏನು ಆಗಲ್ಲ ಅನ್ನೋದು ಗೊತ್ತಾಯ್ತು.
Okay. Thank you, Rajana sir. Now, should I ask somebody else or anybody will volunteer? Shri Manjunath sir, CP Manjunath sir.
Yes, ma'am.
Can you enlist some of the hurdles in providing services to the victims?
Victims, ನನಗೆ ಕರೋನಾ ಬಂದಿತ್ತು ಮೇಡಮ್ 2 times.
Yes.
ಫಸ್ಟ್ ಟೈಮ್ ಏನು ಇದಾಗಿಲ್ಲ, ಅಂದ್ರೆ ಟ್ಯಾಬ್ಲೆಟ್ಸ್ ಏನು ತಗೊಳ್ಳೇ ಇಲ್ಲ, ಹಂಗೆ ಹುಷಾರಾಯ್ತು. ಸೆಕೆಂಡ್ ಟೈಮ್ ಟ್ಯಾಬ್ಲೆಟ್ ಕೊಡಬೇಕು ಅಂತ ಫೋನ್ ಮಾಡಿದ್ರು. ಆದ್ರೆ ಫೋನ್ ಮಾಡಿದ್ರೆ ಅಲ್ಲಿ ಫೋನ್ ಮಾಡಿದ್ರೆ ಏನ್ ಹೇಳಿದ್ರು ಅಂದ್ರೆ ಟ್ಯಾಬ್ಲೆಟ್ ಎಲ್ಲ ನಾವು ಹೊರಗಡೆ ಹೋಗಕ್ ಆಗ್ತಾ ಇಲ್ಲ, ಐಸೋಲೇಷನ್ ಅಲ್ಲಿ ಇದ್ದೀನಿ, ಕ್ವಾರಂಟೈನ್ ಅಲ್ಲಿ ಇದ್ದೀನಿ, ಟ್ಯಾಬ್ಲೆಟ್ ಕಳಿಸಿ ಅಂದ್ರೆ 1 week ಆದ್ಮೇಲೆ ಕಳಿಸ್ತೀನಿ ಅಂದ್ರು ಮೇಡಮ್. ಬಾಯಿನೆಲ್ಲ ಬ್ಲಡ್ ಬಂದ್ಬಿಟ್ಟಿತ್ತು. ಆದ್ರೂ ಹಂಗೆ ಸರ್ವೈವಲ್ ಆಗಿ ಇದ್ದು ಒಂಥರ ಇದಾಗಿದೆ ಮೇಡಮ್ ನಂಗೆ ಒಂದು ಪರ್ಸನಲ್ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್. ಕರೆಕ್ಟ್ ಆಗಿ ಟೈಮಲ್ಲಿ ಕೆಲವು ಸರಿ ಕರೆಕ್ಟ್ ಆದಂತ ಟ್ರೀಟ್ಮೆಂಟ್ ಸರಿಯಾಗಿ ಸಿಗ್ಲಿಲ್ಲ ಮೇಡಮ್. ಅದೊಂದು ಮಾತ್ರ ಇದಿದೆ. ಯಾಕಂದ್ರೆ ಕ್ವಾರಂಟೈನ್ ಅಂತ 15 ದಿನ ಕರ್ಕೊಂಡೋಗಿ ಹಾಕ್ತವ್ರು, ಮತ್ತೆ ಅಲ್ಲೆಲ್ಲ ಬೇರೆ ಕಡೆಗೆ ಹಾಕೋದು ಒಂಥರ ಇದಾದಂಗ ಆಗೋಗಿತ್ತು. ನಮ್ಗೆ ಒಂಥರ ಭಯ ಆಗೋಗಿತ್ತು ಆ ಟೈಮಲ್ಲಿ. ಬಾಯಲ್ಲೆಲ್ಲ ಬ್ಲಡ್ ಬರ್ತಾ ಇದೆ, ಇವ್ರು ಫೋನ್ ಮಾಡಿದ್ರೆ ಇನ್ನೊಂದ್ 3 days ಬಿಟ್ಟು ಕೊಡ್ತೀನಿ ಅಂತಾರೆ. 3 days ಗಂಟ ಉಳಿಯೋ ಅಂತ ಚಾನ್ಸಸ್ ಇದೆ ಅನ್ನೋದೇ ನಂತರ ಭಯ ಆಗುವಂತದ್ದು.
ಸರಿ,
ಆತರ ಎಲ್ಲ ಆಗೋಗಿತ್ತು ಮೇಡಮ್.
Okay, thank you. So, to the benefit of those participants who do not understand Kannada, the previous participants, one of them told that during COVID, when one of the victims was supposed to get admitted to the hospital, no one came to their support, and due to the time lapse, the person could not avail the treatment, and hence he passed away. But even after his demise, there was nobody in the village ready to cremate the body, and it was a very difficult situation to get the last rites done. And the other thing shared by another participant, so the hurdle there was that of lack of support by others. In the second case, lack of availability of resources on time. The person who shared it, one of your colleagues, he himself had COVID 2 times, and during the second time, he was under quarantine and he needed to take medicines. But when he approached the helpline for medicines, they said they will give the medicine after 1 week. Whereas he had already started showing symptoms of bleeding in the mouth and he was wondering whether he will survive, but the medicine was not coming at all. So, non-availability of resources at the right time was another difficulty which was shared by the participant. So thank you, both of you, for sharing your experiences. Now, what I want to share here with our participants is professional management of multimodal services during disasters. This is what is required actually, because when we talk about any disaster, as others might have already told you, there are multiple agencies involved, governmental agencies involved, non-governmental agencies involved, as well as volunteers and professionals from multiple fields, including, most importantly, the rescue rehabilitation people from National Disaster Management Authority, or from the State Disaster Management Authority, district services, as well as local governance. Every one of them are involved. Government related services are involved. And during rescue and relief operation, some Ganji Kendras will be going on. People will be given shelter somewhere else. So their medical requirements are there. Their sanitary and water and biological requirements are there. And fear of communicable diseases is there. So with all these things going on simultaneously, there is a dearth always felt for non-availability of resources due to lack of coordination between various agencies. This can be a major hurdle in management of disasters. That is why there is a very, very important need for being prepared for disasters management and need for simulation exercises. What is a simulation exercise? For example, this seminar or 1 week short-term course itself is a simulation where you start thinking about how can I be prepared in case of a disaster. I'm sure Dr. Ashok Sangnal would have talked to you about disaster preparedness kit. In case a disaster strikes, we should be able to keep this kit in readiness, easily available, accessible, take that kit with us and then move out of the disaster situation. It should have some essential elements for human survival. But how many of us are really prepared like this? We are not prepared at all. So under these circumstances, it is important to look at how well we can prepare ourselves individually and also our community so that the disaster management can be effective in minimizing the harm and maximizing the survival rate. These are the two things that we have to keep in mind. Now, when I come to talk about the profession of social work, let me just briefly elaborate on what is social work and why is social work relevant for disaster management in the context of professional management of multimodal services, need for preparedness, and need for simulation exercises. So, social work is the art of bringing various resources to bear on individual, group, and community needs by the application of scientific method of helping people to help themselves. So here our aim is not to simply provide a service for the sake of providing it. It is helping people to help themselves. And through what? Through a need assessment. That is very important here. What is required for the community? What is required for the individual? What is required for that particular group? That only has to be catered to, not something which is unrelated to them. And social work aims at creating conditions for individuals and groups under which they are able to utilize their potentialities and existing resources to remove some of the handicaps and to overcome them by proper adjustment in order to live a life more adequately and creatively. So these are basically looking for whatever is available under the limited resources, limitations of the individual, limitations of the circumstances. Like, for example, in a disaster situation, ideally we must have everything ready on hand to be able to provide services. But unfortunately, it doesn't happen that way. All the resources would have got drained or lost. For example, Kerala landslide. Villages got totally submerged in the mudslide, mud that fell on them, the earth that fell on them, the trees that fell on them. They had nothing. And outside world had so much difficulty in reaching to the victims. So under these circumstances, what we have is very, very limited number of options. Even in that situation, how best the situation can be turned around, making sure that the human spirit to survive is intact and they help one another along with whatever available resources are there, pull that in and be able to survive the trauma, both physical, mental, and also financial, as well as others. Social work is thus a helping activity, it is an enabling activity, and also a liaising activity. So, these three things are key to our profession. So, first is help giving, second is enabling, and third is liaising. All three are important. We have to look at the physical health, we have to look at the mental health, and we have to look at the social health. And for all the three, we liaison with others because we don't say that we are experts in everything, but we liaison with others who can provide those services. So these three things are really key to providing disaster management also. So social workers are interested in reform and helping the individual in adjusting to present circumstances. In the next slide, I'll be sharing about what the basic principles of social work are. So in that, I will be saying that every individual is capable. So whether it is tsunami, whether it is earthquake, whether it is mudslide, whether it is flooding or cyclone, whatever, at that moment, the individual may be helpless. But when given the right chances, the individual will overcome the difficulties, will overcome the hurdles and be able to restart one's life. That is what is the human spirit, and social work believes in that spirit and it helps the individual in adjusting to present circumstances. When there was work going on with tsunami survivors, one of the first things few of them told was like, I was owning 3 boats and I had employed 50 people. Today I have lost everything. I am a pauper and I have to stand in queue in a Ganji Kendra to get 1 square meal, not even 2. To even get 1 bowl of Ganji, I have to beg somebody. So how can I even reconcile to this situation? I have been the richest man in my village. Now I am less than the beggar or equal to the beggar. So how can this individual adjust to the present situation? Everyone will definitely feel that type of changed circumstance, making them worry about their future. So that's but natural. It's a natural reaction to an abnormal situation. This type of grief, this type of anger, this type of frustration, everyone when faced with a disaster is common reaction. So how to help them? Social work is a helping activity. It is an enabling activity. The individual will be enabled to do something about the current situation and with the help of liaising with other organizations. So we use different methods of social work to provide the services. The first thing we need to know is we use 6 methods of social work. One is the first one is when we work with individuals, it is called as social casework. That is, people hit by disasters, when they have been brought to relief centers, disaster management centers, we work with each individual. The first and foremost thing will be, when we have rescued so many, there is always concern for people whom they have lost in the disaster. So who are those people who are lost? Near and dear ones. Usually it is the children, elderly, women, or sometimes there may be deaths of near and dear ones. So they will be facing a lot of grief. So working with individuals, that is social casework. Second is working with the group of people. Group of people who have lost everything, who are staying in the disaster management center and helping them to overcome their grief collectively. Many a times it so happens that people facing disasters, like yesterday's session, Dr. Lancy would have definitely highlighted about the impact of grief and depression on survivors and survivor guilt. In tsunami, I keep referring to tsunami because while in NIMHANS, a lot of work on tsunami as well as Gujarat earthquake took place, and they have recorded and brought out a number of booklets on managing psychosocial management of disaster survivors. So I go back to those examples frequently because there were 2 major disasters which had a huge impact on a large number of states, not just one state, especially the tsunami. So, like I said, the survivor guilt. Some of the women were crying that I could not hold my child tightly. The child was taken away by the sea. I survived. Why did I survive? A grandmother cries and says, my sons are gone, my daughters-in-law are gone. Only I am living with my 4 grandchildren. What do I do? How can I bring up these children? Why did God leave me here to face this type of situation? And this type of survivor guilt as well as frustration, these are commonly seen. And many a times people become isolated. And the men usually resort to alcoholism because they cannot face the situation anymore. So these further aggravate the family conditions. So working with the groups of people, identifying their common grief, and then what are their requirements, collectively helping them to overcome these difficulties. Then community organization is working with that whole community, maybe adopt a whole village, work with that village to rebuild. For example, Kerala landslide. Now, after the landslide, initial support is over. Now, the rehabilitation has to take place. For that, the whole village has to be either relocated or rehabilitated, and everything from revenue department to sanitation to building to every one of us departments, multimodal agencies will have to come together and plan it. When they have to plan it together, the stakeholders or the people who are victims of this major disaster, they have to have a say in what they want and how they want it and how they expect it. So, and they in turn, they also have to contribute, either may not be in terms of money, but in terms of labor, manpower, and expertise with regard to how they want their village in future to be. So their involvement is a must. So for that, community organization is the method of social work which is used. And welfare administration is one of those where, see, in disasters, sometimes we get so much of, contribution from people. But most of the time, it is not distributed properly. Usually the services get focused on one is major area. where a lot of devastation has taken place, or the second is the first place where people are able to reach. They are the ones who get the maximum benefits. The ones who are the last to be reached out, they will have very little because the access to them itself has been difficult. And secondly, usually cities get priority over villages and they are left to fend for themselves. Remote areas also do not get the required welfare benefits. And sometimes it so happens that people donate a number of things, but all the donation may not really be useful to them. For example, again in tsunami, a number of people from northern states, they sent salwar kameezes. But the women in southern states preferred sari. And they said, we don't use this, especially the fisher women folk who had lost everything. They were like, this is a mismatch. So what is required has to be properly conveyed to the donors and then provided with. And then only it is utilized. Otherwise, the services or items are sent, but they may not be utilized properly or they may not reach the beneficiary properly. And another thing we need to be cautious about, and when we are doing any of these voluntary service or taking things, collecting things, that there are a number of spurious sites and spurious elements, antisocial elements, trying to cash in on the disaster situation and try to siphon off the funds sent for the disaster management. Unless they are government websites, we need to be very careful as to who is the person who is trying to collect these type of things, whether that person or the organization is a reliable organization. So all these things will have to be checked out. Welfare administration looks at smooth running of these facilities. Then research. Every help giving activity is also scientific, has to be scientific and systematic. If it isn't so, then what happens? There is no way to measure whether our help was useful for them or not. So social work research is actually an action research more than a theoretical research. It looks at how far or how effective have been our programs, help giving activities in helping the beneficiary. So only when that matching is there, then we can say this model of help giving has helped or not helped, and it should be carried out or not carried. So simply giving doles is not the solution to eradicate poverty. The first thing that social work teaches is that teach a hungry man how to fish. That is the Chinese proverb. Many of you would have heard about it. So give him a life skill through which he can go satisfactorily without hunger for his lifetime. Teach him such skills that he need not depend on others to give him fish. He can catch the fish and he can feed himself and he can feed others also. So that is what is the maxim of a social work. So research is one which has showed that this is what you need to do. You can't simply make people keep on depending upon what you give. You have to teach them how to earn for themselves, how to become independent of others, how to not depend on others for support. So social work research is that, and sometimes we also look for social action, advocacy for different groups so that their rights are looked into. For example, parent support groups for mentally retarded children, support groups for physically handicapped, and need for legislations to provide protection, for example, for the disabled, for the mentally ill, for the physically handicapped, all this is through social action or advocacy for the rights of the marginalized groups. So these 6 methods of social work are applied in different practice settings, such as a clinical setting like psychiatric social work, industry and labor welfare. It is applied in rehabilitation of the physically handicapped, mentally handicapped. It is applied for families in crisis. It is applied in various settings. You name the setting, the social workers work in, because problems are universal. Refugees, how to help the refugees, how to help migrants, how to help people who have suffered personal losses, and people who have been affected by disasters also. So likewise, the field is vast, where it is the application of practical knowledge. That is what matters in social work. We do not theorize. We go to the field, we work in the field, we work with the people to ensure that they get the maximum benefit of the services which are provided to them. So it is developed from practice to theory. It's a practice-based profession, and it has absorbed from a number of allied disciplines like psychology, sociology, economics, political science, public administration, anthropology, management science, and so many of the different disciplines. So it's a multidisciplinary, we can also say. It has taken from a multidisciplinary faculties also on what is the best way to provide help. And the most important person in social work practice is called the client, or the individual who is the focus of the attention. What we say that last mile approach, last household, and the last beneficiary. Everybody must get involved, including those who are the least reached, who require maximum help. That person is very important. And it assumes, like I said before, that every person is capable, every individual is worthy, and they are capable of resolving their difficulties and challenges with assistance, with professional assistance from the social worker or through various agencies which are there established to ensure that the last person is benefited, and through the process of service rendering. So now in Karnataka, many of you might have read in the newspapers, many senior citizens are not able to avail the rations due to inability of the machines to read their fingerprints, because due to old age, many of their fingerprints, so biometric signature is not possible. It is erased due to old age. Earlier, they used to send it through OTP. OTP based, when they could not give the biometric attendance for collecting the ration, they were given OTPs to the mobiles so that they could collect the ration. Unfortunately, the government has stopped that because they found that the OTP given and the number through which the OTP is given, and then somebody else is taking away the ration and it is being misused. So government in its own discretion decided that this is not fair. The grains meant for the beneficiaries are not reaching the beneficiary. So henceforth, we will use the biometric. But unfortunately for senior citizens, it so happens that the biometric machine is not able to read the fingerprint due to the erasure of the fingerprint due to old age. So now this is the problem. So this service rendering, how to bridge this gap? So the next option will be iris scanning or the eye scan. But eye scan also, the ration shop owners are saying that we cannot go to their doorsteps to scan their irises. And the iris scanning machine is going to cost a little more money. So the government will have to come up with some solution so that the senior citizens, the genuine beneficiaries, are not denied the ration, free ration, yet the practice of siphoning off the ration by others should also be avoided. So this type of, the process of service rendering, and it should reach them on time. What is the point if like somebody dies, a senior citizen dies of hunger because his biometric could not be catched and his ration is not provided? So timely rendering of service is also equally important. So for all these things, a quick resolution of problems which arise when we are giving service is also part of ensuring that the client becomes more self-sufficient. So this is what is equally of importance. These practices are very important in disaster management, placing priority to what the client wants. And it makes the beneficiary an equal participant and not just a spectator or a receiver of the doles from others. This is very, very important for us from disaster management perspective. So, what we need to do or we do in social work is working with affected individuals, families, and communities by proper liaising with multiple agencies in providing the services. It is like social worker is that one point contact who knows the individual, because for us, the focus of attention is the client, the person who has lost the things in the disaster, who has survived, but who has so many requirements to be able to reach a level of functioning where he can become independent of these supports. So for that to happen, what are his requirements? Okay. So for example, a fisherman will require nets. Fishermen will require boats. What type of boats? What type of nets? What type of oars? Or what type of mechanized boats are needed? They have to be those to which the beneficiary is used to it in the earlier days. Or you are giving new technology, you are giving a new boat, then you must also make effort to teach that person how to handle that boat and that machinery. And then only you can send him to the sea to start fishing. So without giving that preparation, you provide all the modern gadgets. It is of no use to him. So money is spent, but it is not yielding any results. So the irony of, toilets being built. In many villages, people use the toilets which are built on government money to store wood, firewood. Then what is the point? Toilet is, if it is not used for the purpose for which it was built. So the problem here is the user is not made aware of the benefits of using a hygienic sanitary practice and what are their reservations about using the toilet. Is it the water problem? They don't have a water facility, running water facility, so they cannot use the toilets? Or is it that their attitude that they should not use the toilet there near the house because it is unhygienic? That is their belief, because they feel going to fields is the right way to do. So in those cases, what happens is that the purpose with which it was built is not served. So what is important is that the participant, the receiver, has to be aware of what he is receiving, why he is receiving, and whether he is willing to receive it, and whether he is willing to utilize it. So when all these things are considered and given, then only what is given is really appreciated. Otherwise, it will be just considered as something not useful. They have simply given, let it be kept somewhere. So this should not happen, especially when we are talking about disasters, because the resources are scarce and the beneficiaries' requirements are many. So there should not be any mismatch between what is required by the beneficiary and what is given by the service agency. So this thing we need to ensure. And for that, social work profession paves the way. So this in brief about what social work does and how it can be a key change agent while managing the disasters and helping the clients or the victims of disasters to be able to effectively get reintegrated into the society as people who are contributory members to the society. So with this, I will be stopping my presentation. I want to do another exercise with all of you. So this is the exercise. I want you to take 5 minutes to write down, all of you. Please switch on your videos so that I can see you quickly. Everyone, switch on your videos. Yes. I don't see people switching on the videos. I see only their names. Shall I start taking attendance? Manjunath, Ranjit, Sahana, Honnegowda, Shruti, Ramesh, Professor Manisha, Dr. Jayaprasad, Nitin Pode, Rajkumar, Manjula. Manjula is from MMTTC. Sanaullah, Vaishnavi, Veeresh, Chaitra, Surendra, Shubhangi, Appa Sahibji, Saudagar, Ravindra, Pushpashri, Shankar. None of you have switched on the videos. Why? Now people are becoming awake. Usha Rani madam. Pushpashri madam, are you there? Shankar, Ravindra, Shankar Nayak ji, Dr. Jadhav, Professor Maske ji, Appa Saheb, Krishna Joshi ji, Shubhangi, Dr. Surendra, Vaishnavi, Dr. Jayaprasad, Honnegowda, Ranjit, Manjunath, all those names I have called, they are not in session. Are you all?
ಮೇಡಮ್ ಇದೀವಿ ಮಂಜುನಾಥ
Then why
ಇದ್ರಲ್ಲಿ
they are not switching on the videos?
ಮೇಡಮ್ ಆನ್ ಮಾಡಿದೀನಿ ಬರ್ತಾ ಇಲ್ಲ
ಬರ್ತಾ ಇಲ್ಲ ಅದೇ sir, they are not there. Anyway, fine. Those of you who are here, I want you to quickly, because we have another 10 minutes before I can start session for questions. Okay? Write down how would you involve yourself and your students when faced in a disaster, or how would you make a disaster management plan with only one activity. What is your plan? Like all of you know that there is preparation required, there is vulnerability assessment, when there is a disaster, definitely immediate rescue and rehabilitation, and then finally reintegration into the community. These are the steps. Any one aspect you take and any one activity you plan immediately. What are the steps from all these 4 days? What you have learned, and write down the steps. Only one activity. For example, you want to do vulnerability assessment in your own college. Let us say if there is a fire which is going on, suddenly you see a fire in the corner of the building and you want to evacuate the students. What would be the steps that you will take to ensure that there is no casualty and all of you are safely out of the college. So something like this, you plan one activity, enlist your requirement. What are the things that you need for that? And what are the bottlenecks you have to clear to give it an effective service? So your time starts now. I'm giving you 3 minutes to quickly do this. I know it is not much time, but start doing it. I will be seeing you all. Please keep the videos on. Start off. And I will be asking you to share it also. Chat box, you have to type any one activity. It is something that you have to plan it in your college. And that means with your students, not college, with your students, involving your students. Right. Please keep posting in the chat box. I like the interventions proposed by many of you. Thank you for posting it quickly, and you have assimilated quite a lot through this 1 week of short-term course on disaster management. Now, I would like to highlight 2 things here. Your plans are quite good. Some of you have taken it to only the fire incident that I quoted. It need not be, but whatever it is. In the second slide, I think I talked about disaster preparedness includes simulation exercises. That means what we call as before we stage the final play, we make as full dress rehearsal. If you are from theater background, you will know. So what is full dress rehearsal? Any parade before the main event, we do a full rehearsal. That is called full dress rehearsal. So likewise, in disaster management, what is important is not just preparedness. There is also a requirement for doing a full preparation simulation. That means as though the event has occurred. If you have noticed in some of the malls, they have fire rehearsal, fire preparedness rehearsal, because so that they know whether all the people are alert to the emergency signals and whether everybody is doing their respective allotted jobs. Like one of you have mentioned in the chat box about for preparedness for fire drill, identifying the entry points, exit points, bottlenecks, everything you have mentioned. That is good. Likewise, in a disaster situation also, we need to, as much as possible, practically possible and feasible, prepare and rehearse the particular type of disaster preparedness. So that rehearsal is very, very important. For example, in a flood area, let us say, what is important is that when flood evacuation warning, house evacuation warning is given, how many people are able to leave the house in, let us say, within 30 minutes? Within half an hour, how many people can leave and how many cannot? And what happens to those who cannot? If the flood water submerges and they are drowned, then the preparedness and planning that we did is not of any use. Within half an hour, nobody comes out of the house. Everybody is sitting at home only. Then your whole disaster preparedness is of no use at all. So this type of practical, wherever it is possible, making it practically, possible activity is very, very important. So what is important in your colleges is that when you ask your students to do any of this, you need to also make them to demonstrate. That is important. Unless it is demonstrated and its impact is seen by them, they will not understand they take it lightly. So that is what I wanted to make you people to realize, that only when it is hands-on, then the involvement is there. And the commitment to be prepared for disaster and be able to become a volunteer and get the strength to face the disaster, all three will come hand in hand. So with this, I want to say that I also wanted to demonstrate through this that social work is something which is always looking at practical solutions and not theory. So that is why I wanted you people to participate in it as much as possible, so that you start identifying yourself with what you have learned and how best it can be used in your practical settings, work settings. So with this, I would like to conclude.